Hi Mobility Innovated fam, I'm hopping on here today to talk about a recent blog I posted to our website about pain. This is the first blog of a series I'll be writing about pain, what it is, how it works, why we experience it, what we can learn from it, and what happens when it becomes persistent or sticks around for longer than we want. So first things first, this blog was just kind of about the basics and about how pain is inherently good, right? It is meant to be a protective mechanism, to act as a warning system to us to tell us there's a potential threat or we need to maybe change our circumstances to avoid injury or harm. And it also helps us to learn from those experiences so we can prevent them from happening again in the future. Pain is 100% always created in the brain. Yes, we have nerves that help send signals from throughout the body, and these messages come through the spinal cord and to our brain, but ultimately the brain decides whether or not that signal is worthy of being painful. And it uses all sorts of other information that's stored in the brain in terms of memory, emotions, chemical balances, and your current state to ultimately tell you whether or not that thing is painful. Pain does not always equal tissue damage, which can be the frustrating part because oftentimes we associate pain with an injury, damage, problem, something we need to take care of, but that's not always the case, and it becomes less so the case the longer the pain is around. So when we have persistent pain that's around for like 4 to 6 months, it's less likely to be associated with that tissue damage as, say, pain that came on after an event that happened yesterday or last week, right? That might be more related to tissue damage. And this can be frustrating, and it can become counterproductive over time because that pain is no longer warning us of a threat or potential injury, but rather we have seen some maladaptations within our nervous system that has had that pain linger. And that's what we're going to be diving into in our next blog about changes that happen when we see pain become persistent or chronic and when it is not as associated with tissue damage as something like acute pain. So reach out with questions that you have about pain, or if you've checked out this blog and you've sparked some curiosity surrounding that, and keep your eyes out for our next blog as we dive into that persistent pain.